This year's annual report focuses on improving the health of children using schools as a setting. The reason we've chosen to use schools as a setting is that it's a way of reaching all of our children in one go. And we believe that if we offer effective interventions to all of our children, it's also a way of reducing inequalities. Our overarching strategy here is to improve healthy life expectancy, not necessarily how long people live, but how well they live. And if we are to do that, it's absolutely vital that we start with children, start whilst they're very young. We have evidence that the health of our children is jeopardised at a very early age. We know that our kids are leaving school more overweight than the England average. We know that we've got issues with emotional health and well-being, and that all impacts on a child's health at that particular time. We're seeing an increase in childhood diabetes rates, and if that's how they're starting off their life, it doesn't bode well for their adult life. And we can change that by working with schools, by addressing the type of food that they eat, increasing the physical activity offer, making sure we've got a sound mental well-being and resilience offer for schools. We can change the course of children's life, impacting on their health whilst they're children, but also giving them the strong foundations to become healthy adults in the future. Sandwell is a deprived area, and our residents suffer multiple deprivation. Our children are more likely to live in poverty. They're more likely to experience the need for protection or safeguarding services. They're more likely to have emotional health issues. They're more likely to have special educational needs. And all of those factors impact on our services. And often our services aren't adequately resourced to deal with those challenges. And in addition, we've got a growing young population. We've got a high proportion of our residents in the childbearing years, and we've seen an increase in birth rates over the last 5 years, and that is going to further impact on our need for services, and we may not get additional resources to meet those needs. Emotional health and well-being has been a growing concern for me, both in terms of our children and our adults, and the quality of services and the level of resources we've got to meet their needs. Prevention has got to be key because of the scale of the problem. It is huge. We know that we've got rising levels of self-harm, eating disorders amongst our kids, behavioural issues, and we can't allow things to escalate and let services pick up the problems at the end of the road. It's important in itself as an issue because of the consequences that it has for the children, young people and the adults of our borough, but also we believe it's an underpinning resource for people in order for them to engage in healthy lifestyles. So, for example, if your emotional health is poor, you're less likely to eat well, you're more likely to use alcohol and less likely to take exercise. So for us, it's an absolute essential in terms of people's ability to live healthy lifestyles. It's an underpinning requirement, and that's why it's so important to us. We've set up a school health improvement group that brings together public health and education colleagues, and we've developed a plan to improve school health as part of that group. Working with schools is absolutely a vital relationship for us, and we've been working on that over the last year. We've offered schools small grants for health promoting projects or equipment, and we regularly attend learning communities, which are small groups of schools working together at a local level. And our partnership has really developed and is blossoming with schools, and they are working effectively with us. We've also we're working on developing school health profiles to give back schools information about what their health outcomes are, things like educational attainment, obesity, immunisation rates, all of that kind of thing is in the report with comparators, so they can compare themselves to schools across Sandwell and England. And we're hoping to use that over the coming year as an engagement tool with schools, so that we can have a dialogue with them and say, well, these are the needs in your schools and these are the sorts of things you're currently doing, and here are the gaps and how can we work together to address them. We work closely with children and young people in developing our strategies and we engage them in developing them quite actively. The Council has a strong engagement function that we've branded SHAPE. We've had conferences and surveys, and health has often been a feature of those events that we've had. And in response to children and young people's views and challenges to us, we developed a couple of activities to respond to their desire to have more opportunities to be physically active, and they are a summer parks programme and a youth festival which offers them lots of opportunities to do things like Zorb football and and other challenges, and that was a direct response to their wishes. They've also taken over a number of our boards and committees, so they've taken over the Cabinet and they've taken over the Health and Wellbeing Board, and school food has often been a feature of those dialogues, and they have often raised concerns about the quality of the food that they're getting. In this report, I really wanted to hear the voice of children. Whilst we've got data on outcomes like obesity and immunisation rates, what we don't have is the insight into how children experience their school days and what they can tell us about how the school could be helpful in improving their health. And often they have the answers. They know what needs to change to improve their health and so on. So I don't think we can do this without them.